copies of the PowerPoint that were on the end of the chairs, and then over on the side there, I didn't want to force more paper onto folks, but there is a worksheet that I think might be helpful to you. It has the federal poverty level, and I'll be referring to federal poverty level, FPL, and sometimes it's really good to put a number and an income to those percentages. So if you didn't get one, they're over there. And I'll also be referencing some of the other handouts that are available to you that you can pick up on the way out as well. And maybe with that, we can get started. I'm Joy Tapper. I'm a member here at St. Matthew's, and I am a resident of Wauwatosa. And I am, during my day job, I work for a consortium called the Milwaukee Health Care Partnership. And Sue Swig invited me to come today to speak with members of the congregation. She asked me to share a little bit about the partnership and what we do in the community, but then also drill down into one of our major initiatives, and that is doing outreach and education and providing enrollment support for individuals who are needing or looking for insurance coverage. So I'll spend most of the time talking about the insurance reforms under the Affordable Care Act, as well as the insurance reforms that are happening in our own state under Medicaid. And then hope that it's of help to you just to know what's happening in our community and in our state, but also that it might be helpful to you personally if you have questions about your own insurance coverage for a family member or a neighbor or a friend. And I'll also be referencing how the Affordable Care Act has already affected my family in terms of provisions that are already enacted and what implications it's had for people in our community. So I'd like to begin by per Sue's request to talk a little bit about the project that I staff and have been working on for the last 7 years, and that's called the Milwaukee Health Care Partnership. It's, hi Sue, did you have any other comments?
I'm sorry to interrupt. I just wanted to make sure that everyone can hear okay with the noise out here, and we do have the capability to have a microphone on you.
Oh, yes. Can you hear? Would you like me to use the microphone?
Yes.
Yes. Okay, very good.
Thank you.
Thank you. I always feel like I should sing Feelings or something. And I might need some help. That's bad. Test, test. Try that. Okay. Well, maybe while he's working on the battery, I'll just talk really loud. Thank you. And if you ever can't hear me, raise your hand or ask me to repeat something. So I was saying, my name is Joy Tapper. I live in the community. I'm a member of St. Matthew's, and I also am the director of the Milwaukee Health Care Partnership, which is a 7-year-old public-private consortium that is focused on improving health care for underserved populations in Milwaukee County, namely low-income, uninsured, and Medicaid beneficiaries in our community. And I'll talk a little bit about how many uninsured and Medicaid individuals are in our Milwaukee County. The partnership was commissioned by the health systems in 2007. So the 5 health systems, Children's, Columbia St. Mary's, Wheaton Franciscan Healthcare, Fredert, and Aurora, because they saw a need in our community, a growing need, given the number of low-income vulnerable populations, the rise in uninsurance, and continued use of emergency department care for primary care services for many individuals. And since its inception, the membership includes the CEOs of the 5 health systems, the 4 federally qualified health centers, which are community health centers located in low-income neighborhoods throughout Milwaukee County, the Medical College of Wisconsin, and then the city, county, and state departments of of Health or Health and Human Services are all members of this consortium. And since its beginning, we have had 3 primary goals. One is to secure adequate and affordable coverage for low-income individuals. The second has been to ensure access to quality primary and specialty care, including behavioral health and dental services, and improving care coordination across the community, getting people at the right care at the right time at the right place. And we have a plan and many initiatives, but it's really the coverage goal that I'm going to be focusing on today of the partnership. We've been working on Medicaid policy advocacy and reform since 2008, as well as enrollment since that time. But it's the introduction of the Affordable Care Act, coupled with, thank you very much. Better? Hello? No? No difference? Okay. We'll keep talking loud. It's really the introduction of the Affordable Care Act, coupled with the state Medicaid reforms that have elevated the need for outreach, education, and enrollment in our community and across our state. So we've expanded our enrollment initiative and created what we're calling the Milwaukee Enrollment Network, which is made up of over 100 organizations, community-based organizations, faith-based organizations, government entities, and the like. There we go. That is focused on supporting the enrollment of Milwaukee County residents in public health benefits for which they're eligible or private insurance via the marketplace, with a focus, again, on low-income and vulnerable populations. And this is co-convened by the Milwaukee Health Care Partnership, the consortium that I staff, as well as a statewide organization called Covering Kids and Families, and the Department of Health Services for the state of Wisconsin. Our goal as an enrollment network is to train up and support over 160 enrollment workers. These are individuals who assist people with enrollment throughout the county, and to enroll 33,000 newly eligible Medicaid recipients and another 26,500 in private insurance via the marketplace or the exchange.
Are those paid positions or volunteer?
They're both. They're primarily volunteers, and they're individuals who work in health systems, in community clinics, in churches, in free clinics, and the like. So today I'm carrying out one of our strategies, and that is consumer outreach and education. And generally our presentations are focused at low-income, vulnerable individuals, but we also have been training what we're calling mobilizers, people who interact with low-income individuals or people who don't have insurance or are underinsured, for whom this information can be helpful. But as I said at the onset, this information may also be applicable to you and or a family member, and I'll highlight some of those opportunities. So the Affordable Care Act, also known as Obamacare, and the new state Medicaid reforms, and in Wisconsin, our Medicaid program, which is insurance for low-income children, families, elderly, blind, disabled, is called Badger Care, so I'll be referring to it as Badger Care. These reforms at both the federal and state level create all sorts of opportunities for new coverage options, but also challenges. And I wanted to just provide an overview of some of those key reform measures and share information about enrollment and enrollment support resources for people. My focus today is to focus on education about laws as they exist. It's not to debate the merits. I think a lot of that's going on in the community, and one of the commitments of the partnership and of our enrollment network is to stay politically neutral. What we're here is to talk about what are the laws that are enacted both at the state and federal level, and to inform people about coverage options for them, because we fundamentally believe it's best for people to have insurance to be able to have access to care. And that's where I wanted to also just share my personal lens with you. While I want to remain politically neutral, I come with my own biases and my own personal lens on all of this. And first, my first lens, and it comes from my faith, but also from my sense of civic responsibility, and that is that access to health care, I believe, is a basic human right. Just like food and shelter and security, I believe health care is a basic human right. So I work out of that orientation. And that insurance is the gateway to access to health care. People without insurance have difficulty getting the care that they need and appropriate care. A second value and lens that I have is I believe that health care is also a public good. That it's not only morally right and good, but it's good for a society to have people insured and to have access to health care. This will result in people being able to go to school, work productively, contribute to society, and the like. So fundamentally, I believe healthcare is also a public good. As a result, I also believe government, and recognize government does play a big role already, and should play a role. And not unlike most developing countries where healthcare is funded by government in our society and in our community, over 50% of the population and a growing percent of the population is actually already covered by government-run healthcare. Be it Medicare, which we embraced as a public good in the 60s, and in our state, Medicaid or Badger Care. And I'll give you some statistics about the percentage of people who are already on Medicaid in our community. So government already plays a role in healthcare, and I believe fundamentally as a public good, it should play some role. But I also personally believe in personal responsibility, that we are responsible for our health. And no government, no insurance company, nothing can keep us well. We have to take responsibility for preventative care, for immunizations, for healthy eating, for healthy habits, and the like. So this is my bias as I share my orientation, and you all probably have your own values, but I just wanted to share those up front as I speak to this. So why was coverage reform necessary under the Affordable Care Act? First of all, nationally there are over 50 million people without health insurance today in our country. And there is, in the last 15 years, we've seen a decline in employer-based health insurance. We've seen a growing number of underinsured, and I use that term to refer to people who have substandard or inadequate policies. Maybe they're just catastrophic policies or high copays and deductibles that leave them virtually uninsured because they can't afford those copays, deductibles, and coinsurance. And all of that results in growing uncompensated care. Hospitals, physicians, other community clinics are seeing increases in the level of service that isn't covered by individuals. And ultimately, we bear that cost as a society. It all comes back to those who are insured. As I mentioned earlier too, the lack of coverage or substandard coverage also results in barriers to access. It gets to insufficient care, there's studies that show it results in greater morbidity and mortality, and it results in avoidable high-end utilization, more emergency department utilization, more utilization when people are in crisis rather than preventing or addressing issues at earlier stages in a disease state. We also know we spend a significant portion of our gross domestic product on healthcare, and while we pay almost 3 times more in healthcare than any other country, we rank 37th in our health outcomes. So we're not getting our money's worth in terms of care. So all sorts of reasons why we need comprehensive healthcare reform. In Milwaukee specifically, and these are county statistics, not just the city of Milwaukee, but in the county, We have almost 121,000 uninsured individuals in Milwaukee County, about 13% of our population, 80% of whom are below 300% of the federal poverty level. And again, I handed out earlier, for those who came in late, a schedule of the federal poverty level. So as I throw out those numbers, you can look and see what the income level is for that. And Don said earlier, he had worked with a program in Milwaukee County, the federal poverty level adjustments have not kept pace with inflation. So these are very, very low income individuals as you look at the poverty level. The other thing I want to point out on this set of statistics is that 60% of the, almost 60% of the uninsured in Milwaukee County are employed. So we have this myth or theory about uninsured being people who don't have jobs, who aren't working, taking advantage of the system and like, but almost 60% of the uninsured have employment in our community, and that's true statewide as well. In addition to the large number of uninsured in our community, we also have a large Medicaid population. Again, in Wisconsin, we call Medicaid Badger Care. We have the Badger Care program for children, parents, and pregnant women. And in Milwaukee County, over 200,000 individuals are on Medicaid. That means they're below 200% of the federal poverty level and receive our state Medicaid assistance. In addition to that, there are 90,000 individuals who are elderly, blind, and disabled who also have Medicaid in our community. That means almost 300,000 residents in Milwaukee County, or 31% of the county population, is enrolled in a Medicaid program. And 52% of all kids in Milwaukee County. That's a statistic that should alarm all of us. This reflects the level of poverty in our community and the dependence of low-income people on this state-based program. You had a question?
Yes. How much of a waiting list is there to get on Badger Care Plus?
Thank you. So for children and pregnant women and custodial parents, there is no wait list. But for childless adults, there is, the state capped the program in 2009, and there are over 160,000 people on that wait list right now waiting to receive insurance. So these are non-custodial adults who are between 18 and 65 years of age. So while we do have a very generous Medicaid program in our state, that program for childless adults was capped in 2009, and no new enrollees have been brought on. So we have a significant wait list. Thanks for that question. So that's a picture of the need for reform, and now I'd like to drill down a little bit into the Affordable Care Act. I'll next go into Medicaid reforms and then talk about enrollment. I am not an expert on the Affordable Care Act. I saw Mike last Sunday and he said, I can't wait to come and hear you explain the Affordable Care Act. So I'm going to do that disclaimer right now. But I'll share with you what I know, and I'm also going to focus specifically on the coverage provisions of the Affordable Care Act. Because as you know, the Affordable Care Act has many dimensions to it. It has three primary pillars. One is healthcare financing reform, where there have been some introduction already of new financing methods to incentivize right behaviors and also reimburse providers differently, to incentivize primary care over specialty care, to fund population health management, taking care of populations. There are also a number of delivery reforms that were introduced as part of the Affordable Care Act, including building and learning around the concept of a primary care medical home, that every individual should have a medical home that provides comprehensive primary care and helps coordinate their access to other services. So the Affordable Care Act afforded investments in a number of experiments in those areas, as well as preventative care, public health, many other dimensions. But the area we'll focus on today, and probably that's gotten the most attention, are the coverage reforms and coverage expansion aspects of the Affordable Care Act, and the new avenues to secure adequate and affordable health insurance coverage, either through the health insurance marketplace, which is also known as the exchange, or through state expanded Medicaid programs. Also just want to note that before the debacle of the website, many provisions of the Affordable Care Act have already been implemented. And they're already affecting many of us in this room, and I'm going to share a little bit how they're affecting my extended family. So new provisions that already went into effect in 2012 and this year is preventative care for those with insurance. The requirement to include preventative services as part of insurance policies. The Affordable Care Act also introduced new financial assistance for prescription drugs for seniors, filling that donut hole, if you will. That's already gone into effect. Here's one that I can relate to, maybe others with young invincibles in their household. Young adults can remain, as of last year, young adults can remain on their parents' private insurance. And when our son graduated from college and returned from teaching English in Europe for a year, he came back to a internship with no insurance. And we were fortunate enough to be able to keep him both in the basement and on our but truly, in a recession, this has been a godsend to many young adults in our nation. Another provision that always surprises people as well is insurance companies could deny insurance coverage for children with pre-existing conditions. You can no longer do that. Insurance companies must accept individuals and insure children with pre-existing conditions. There are also tax breaks for small employers, and there's a longer list. But just to let you know, there's already many provisions that have been implemented. In 2014, there are even broader provisions underway, and one is a guaranteed issue for adults. Now adults, come 2014, can't be denied insurance for pre-existing conditions. And let me tell you my brother's story. My brother Jay is 59. He owns his own physical therapy business in Duluth, Minnesota. He had a heart condition. He was dropped by his insurance, and he could not find insurance. So he paid for a catastrophic plan, very exorbitant. He now will not be denied for insurance and will be able to get insurance. As a small business owner, that's really important for him. There's also no annual limits, no limits on coverage. And here's another family story. I have a niece who had a liver transplant at age 34. She takes 45 different anti-rejection meds a day to maintain her health. And they maxed out on their lifetime cap of insurance last year for her husband and their child. Now come 2014, that will be reinstated, and there will be no annual limits on coverage for individuals. Other provisions here, the individual mandate, the marketplace, premium tax credits, I'm going to pull apart even more in the next set of slides. But I just wanted to highlight that the Affordable Care Act is more than the website, it's more than the exchanges, and it has already touched many, many lives. So one of the provisions of the Affordable Care Act under the coverage reform is an individual mandate. And now come March of next year, all individuals will be required to have insurance or pay a penalty. And this provision was an attempt to broaden the pool, broaden the risk pool, and to make sure that there were no freeloaders on the system, so that everybody participated and contributed to their own health and insurance. The penalty this first year, if for individuals who don't take up insurance, will be 1% of their income, very, very small penalty of $95 a year. and it incrementally goes up over the course of years. You see in 2016, the penalty will be almost $700 a year if you don't take up insurance. And there are some exemptions of individuals who do not have to take insurance under the law. Now, with the Affordable Care Act, individuals will have access to insurance through three primary legs of this stool. One is employer-based or private coverage. And there are relatively few changes to that. And I would suspect many people in our community, in our congregation, receive employer-based insurance and will see relatively little change in their coverage, but for the addition of preventative services to their plan if they didn't have that already. The next leg of the stool is public programs. I'll talk about that in a minute, those being Medicaid, Medicare, etc. And the third vehicle for access is the health insurance marketplace or the exchange. And I'm going to pull that apart a little bit right now. So this is the face of the infamous website. Used to have a face of a really attractive young woman who was on there who had got all sorts of notoriety and has been interviewed. That has been taken off for a simpler version of the website. And what is a marketplace or the exchange? It's a place where people can go. It's both a website, a call center, and a mail-in service option where people can go to determine if what they're eligible for, what kind of insurance they're eligible for. They can compare insurance plans. They can choose their health care coverage and apply for discounts or subsidies, also known as tax credits, on their premiums. In Wisconsin, we chose to proceed with a federally facilitated exchange. They're often called FFM, a federally facilitated exchange. There are 36 states in the nation that chose to have the federal government run their health insurance exchange, and we are one of them. The concept behind the exchange is that there's no wrong door, that if it's a place where individuals or families can go to determine whether they're eligible for Medicaid or Badger Care in our state, whether they are eligible for private insurance with tax credits, or they can also purchase catastrophic plans through that website. And later on in 2014, there will also be a shop exchange. Now the website has been delayed till 2015, but small businesses will also be able to purchase insurance through the federal exchange as well. So citizens who are not incarcerated and do not have access to affordable insurance through their employer can access coverage through this marketplace or exchange. And the federal government has defined affordable as if you don't have access to insurance that's less than 9.5% of your total income, you can purchase insurance through the marketplace or the exchange. The first open enrollment period for the exchange began in October 1st. Bumpy start, very bumpy start. And each week we've seen improvement. And I was talking with, I think you mentioned to me, Mike, you enrolled 127 folks as of last week. Yeah. So there's a lot of interest, a lot of activity, and each day those enrollment assisters are seeing improvements in the website. But there are other places that people can go to get and purchase insurance through the exchange besides the federal website. There's a federal call center where individuals can call this 1-800 number and get information about insurance and what's available to them. They can also apply via mail. There are paper applications that individuals can download, send in, and apply. And then also, as I mentioned earlier, there are enrollment assisters throughout the community. And they come in three general categories. One are called navigators. These are federally funded assisters. Wisconsin got very little money for employing navigators, so we have less than 10 in our whole state. And that was because the money was proportioned based on those states that had higher rates of uninsurance than Wisconsin. The second is certified application counselors, and these are the individuals who work in all of the health systems, in the federally qualified health centers, at the Bread of Healing Free Clinic, at the AIDS Resource Center, at Disability Rights Wisconsin. Individuals who have gone through state training and federal training, who are experts in Medicaid eligibility and enrollment, as well as marketplace eligibility enrollment. And they're deployed in all sorts of organizations and are ready to assist folks. And I'll give you more information about how you can connect with one of those certified application counselors. A third type of assistance that's available to individuals are agents and brokers. And in the back of the room right behind Sue, there's a list of agents and brokers who have taken training in both Medicaid and marketplace coverage and have agreed to assist people with enrollment in private insurance via the exchange. So if you know someone who is interested in enrolling and might want to work with an agent or broker, there's a list of certified agents that's available to you as well. So how does the marketplace work? When you get on the website, you create an account, you need an email address, and you provide them with some information about your family size, whether you smoke or not, where you live, and then they will determine your eligibility, whether you're eligible for Medicaid or whether you're eligible for marketplace coverage. You then can also determine if you're eligible for tax credits or subsidies, discounts on your premium. Then you get to view plans, and I'll tell you a little bit more about the insurance plans that are in the exchange. And once you review the plans, you can compare them, you can enroll right through the website or via phone or via mail. So this is the list of insurance carriers who have offered insurance via exchange throughout the state of Wisconsin. And those in red are providing insurance in Milwaukee County and the surrounding area. That's Common Ground Healthcare Cooperative, which is a new insurance carrier in Wisconsin. CompCare, which is the Anthem Blue Cross Blue Shield product. Molina Healthcare, which traditionally had been a Medicaid health maintenance organization or insurer, and now is offering insurance in the marketplace. And then WPS, Wisconsin Physician Services. So those are the four issuers, if you will, or insurance carriers that are offering plans via the marketplace. All of the plans in the marketplace, they're called qualified health plans, have to cover a set of essential health benefits. So all plans cover all of these benefits, including those that I highlighted, which are new. Mental health coverage, which is at a parity level with medical coverage, prescription drugs, and preventative and wellness services. So all of these essential health benefits will be in every one of the plans that you'll see in the marketplace. Of those four carriers or four issuers in southeast Wisconsin, Milwaukee County, they're offering 89 different plans. So there are 89 options in Milwaukee, and they're organized by what's called metal levels or metal tiers, from bronze, silver, gold, and platinum, with bronze being plans that have the minimal set of essential benefits that I just showed you. They have the lowest premiums, but the highest out-of-pocket expense, so highest co-pays and deductibles. And then as you go up the metal level, the platinum plans have benefits above the minimum requirements. They have higher premiums, so higher upfront premiums, but lower out-of-pocket expenses. So it's really important as people discern what plan to choose, they will want to determine, do I want to pay a higher premium and lower out-of-pocket, or do I think that I will not use a lot of care and will have a have a lot of care and use a higher premium and lower out of pocket. Also, the costs of the plan will vary based on the plan itself, the metal level, as well as the cost is influenced if you're a tobacco user, by your age, and by your geographic location. And the geographic location is based on the healthcare cost structure of the particular community. So Milwaukee has a higher healthcare cost structure than La Crosse, for example, or Eau Claire. Actually, I have to do that comparison, go back and do that comparison, but each region has a different cost structure for their work. If you purchase insurance through the exchange, individuals or families will pay anywhere between 2 and 9.5% of their income for the insurance product. And there's a calculator on the Kaiser website where if you go in, give them your age, give them your geographic location, let them know if you're a tobacco user or not, it'll calculate what your annual premium range could be. So you can forego the website and even just look there to see what might be available to you. It's estimated that anywhere between 300 and 482,000 individuals in Wisconsin may be eligible for subsidies or financial assistance for health insurance costs. And that assistance comes in two ways. One is premium subsidies or tax credits that are available for individuals between 100 and 400% of the federal poverty level. So look on your chart, again, what that range is. Though individuals who fall within that income level get premium subsidies, and individuals below 250% of the federal poverty level get discounts on their out-of-pocket expenses. So there are two ways to get discounts through the marketplace, thus making insurance more affordable. I mentioned the federal poverty level chart, and let me just go through this exercise with you. This gives you an indication of an individual between 100 and 133% of the federal poverty level. You see their dollar income range there. They would pay about 2% of their income for their insurance premium, making the premium about $19 to $25 a month. The federal government subsidizes the rest of that premium. That premium subsidy goes directly to the insurer. So you see what that looks like for individuals. And here's a chart for a family of 4 in terms of what you could anticipate for a premium subsidy. This is for a silver level plan. So you remember that bronze, silver, gold. This is a calculation for a silver level plan. So that's an overview of the marketplace, the insurance products that are available in the marketplace, the subsidies that are available for individuals, both for premiums and for out-of-pocket cost sharing. That's going on in our state. At the same time, significant Medicaid reforms are also happening in our state. They were to go in effect January 1st. The governor 2 weeks ago proposed the delay in implementation of those until April 1st, until the website, the federal website is functioning more efficiently. But let me describe to you what those changes will look like. And again, appreciating the penetration of Medicaid in our county, these changes are equally, if not more significant than the marketplace changes. So what's proposed, or what's been enacted in the biennial budget is the governor intends to lift the cap on Badger Care for childless adults, but roll back eligibility from what is now 200% of the federal poverty level to 100% of the federal poverty level. So individuals 100% and below will be eligible for Medicaid. They're retaining Medicaid eligibility for children and pregnant women up to 300% of the federal poverty level. And then the third major significant reform is that there will be standard benefits. all of the benefits will be the same. They will actually look the same as those essential health benefits in the marketplace for the Medicaid population. Plus, there will also now be dental coverage for low-income individuals, preventative dental coverage. What does that mean in Milwaukee County? That means there are about 16,000 individuals who are currently enrolled in Badger Care who are above 100% of the federal poverty level, who will be moved into marketplace coverage. They will go off Medicaid. There are 44,000 individuals who will be newly eligible for Medicaid, which tells you a little bit about, the depth of poverty in our community. So there will be more individuals who will be newly eligible for Medicaid than those transitioning off. You add to that 80,000 individuals in Milwaukee County who are currently uninsured and who will now be eligible for marketplace coverage. You see that there's about 145,000 folks impacted by all of these changes. And we estimate that the majority of them will need some kind of enrollment assistance, because this is complicated stuff. And if your head isn't hurting already, I haven't been doing a good enough job, because this is very complicated and people will need assistance to find the right enrollment. So here are the key dates for the implementation of the exchange. The open enrollment period now runs until March of 2014, and individuals can sign up for insurance. To be eligible for insurance by January 1st, you have to enroll by December 23rd. So if anyone wants to have coverage first day, January 1st, they need to have their application in by December 23rd. After the 23rd, there's a lag period of 15 days before your insurance takes effect. After March, there will be special enrollment periods. So if you have a change in your employment status, or if you have a change in your family status, you have a child or there's a divorce in the family, you can enroll in marketplace coverage under one of these qualifying life events. The next year's open enrollment period begins November 15th of 2014. And just of note, those folks who are low income and eligible for Medicaid Badger Care, there is no open enrollment period. It's continuous enrollment, so anyone who's found eligible can enroll at any time. Okay? Again, there is assistance available by mail, by phone, online, and in person. And in your PowerPoint presentation, this is the website where you can get an application, or you can call for an application. By phone, you can speak with someone who can assist you in interpreting both Medicaid and the marketplace coverage options. And you can also go online and chat with someone about insurance options that are available to you. I mentioned earlier, in terms of in-person assistance, in our community, we have several government-based enrollment assistance resources. One is the City of Milwaukee Health Department has a community healthcare access program called CHAP. They have enrollment assisters deployed at these health centers throughout Milwaukee County, and every Wednesday from 3 to 5 they have enrollment assisters at the downtown public library. There's a bank of computers there, and they will assist individuals with enrollment at the library. There's also the state of Wisconsin has the Milwaukee Enrollment Services Center, which is located on Valete, and then one on the south side at Umos. And then, as I mentioned earlier, all of the health systems and most of the community-based clinics have certified application counselors who are able to assist their patients with enrollment. So if you are a patient at one of the health systems or at a particular clinic, they will have an enrollment assister there who can help you interpret your options, and help you get enrolled as well. And then finally, I mentioned the agents and brokers. If you don't remember any of this, and or you're speaking with someone who has questions and wants more information or enrollment assistance, just have them call 211. That's our information, our community information and referral line. They are our partners in the Milwaukee Enrollment Network, and they help triage people to get them to the right place for enrollment support and assistance. So if you only remember 3 numbers, those are the numbers. What will you need to enroll? What will people need? They'll need their birth date and social security number of all the individuals in their household. Employment information to determine if they have access to employer-based insurance. Income information, if you have a last tax return or a W-2, that works, or if you just have a pay stub, that will work too. Some individuals received notices from the Department of Health, State Department of Health Services, that they would be no longer eligible for Medicaid. If someone got that letter, bring that along, that will help. And then patience, because of many things. One, the website is still being worked out, although I'm very optimistic and had great reports even last week. Last Friday, there were enrollment workers who were doing enrollment, which is really inspiring to me. But also patience, because many of the enrollment workers are still trying to understand all of the various plans as well, as are agents and brokers. Just one thing to note, you will want to make sure that the application assister who's working with you is certified. They have to be certified based on both federal and state regulation, so make sure they're certified. And you should never have to pay for enrollment assistance. These certified application counselors do not get remuneration, and agents and brokers do not get remuneration from consumers. They get that from the insurance companies that they enroll individuals in. So you should never have to pay. If there are scams out there right now, if you hear of any, there's a fraud and abuse line as well as a website. And here are just some final resources for you. Healthcare.gov is the infamous website that you can go to, but I would encourage you to go try it out. If not for yourself, just so that you understand what hundreds of thousands of people are touching each day. Also, there are other videos, informational brochures. If you work with individuals who are low income or uninsured, you can provide them with this information. And then this is the state website that also describes all of the changes in Medicaid that are happening in the state of Wisconsin. So with that, I'm going to pause and see what questions you have or comments or anything people in the audience have that I missed that you think others need to know.
I just wondered then, Consumer Reports also had a website that you could go to and see what you were eligible for when the federal wasn't working.
Yeah.
So with my son, it said, you should go to Badger Care. Well, you can't. You know, they won't even let you on the waiting list. So is that going to change then?
Yes,
Okay.
yes. So assuming that the state legislature is meeting next week to take up this issue of delaying Medicaid eligibility until April. If that happens, unfortunately, those who are newly eligible will not be able to get enrolled until April. So it's this very difficult public policy issue of whether they transition folks off prematurely and they won't be able to get into marketplace coverage, or they delay all of that. Hopefully, maybe the legislature and the governor will enact both. Maybe they'll both delay the transitioning off and open enrollment for individuals below 100% of the federal poverty level come January 1st. That's the advocacy position I would take, but I know that there are economics involved in all of that as well. Yeah.
If a person lives in the state where the where like California's doing their own
Yes,
marketplace?
yeah.
And then they move to Wisconsin?
Yes,
Do they then have to apply here?
yes, 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 yes.
But they won't lose insurance, they cannot be denied?
The
It should be
same,
a smoother transition than in the old days.
theoretically, yes. So the same rules
Yes.
apply.
In
Yeah,
every
same essential
state.
health benefits, can't, guaranteed issue, all of those apply, whether it's a state-based exchange or a federal exchange state, yes. What will be different will be the plans and the cost structure of those plans.
Yes.
Yeah.
And it was interesting when you said that the cost of the insurance kind of depends on your geography.
Right.
That seems a little discriminatory to me.
Yes, yeah, yeah. You know, that's always been of interest, but you can envision that the cost of delivering healthcare in Ashland is probably different than it is in Milwaukee, just because of the number of providers that exist, how the rates are set, health risks, public health needs. So that's what they take into account when they put in the cost rating system for the various communities.
So in other words, even before
Yes,
affordable care, it
yes.
was like less up in
Yes.
Ashland than in the.
Right.
I see.
You know, there are commercial plans now, and they will
Oh.
continue to exist, and the rates vary depending on where you live in the state
Okay.
of Wisconsin.
I knew it was that way for like car insurance, but I
Right,
didn't realize it
right.
was that way for
Health insurance, yep,
And,
yeah.
and homeowners, depending on if you're in an area where you're a distance from a fire station.
That's right. And so there are a number of variables that go into insurance rating, yeah. That's well beyond my pay grade. Yeah. Yeah.
Is the dental insurance just preventive or is it repair?
Ah. So, you know what, Mike, I have to remember this. I know it's preventative for sure. And I think there is emergency dental repair, but it's not restorative. That's my recollection. I also failed to mention that there are also dental plans that are available through the exchange as well. So people can purchase dental plans through the marketplace or the exchange, but there are no premium subsidies or tax credits for dental coverage. Yes.
Two questions. What you just spoke of the dental benefit, does that roll into the people who already have insurance? And then my second question is, I'm hearing rumors that people whose employer are self-insured will have to pay a tax per head of people in those plans, which ultimately is going to make them more expensive and cause people in those plans to be adjusted.
Yeah. So the first question was dental. So I was talking about dental coverage that will now be available for all individuals eligible for Medicaid or Badger care. And that was pre-existing for children and custodial parents and pregnant women. It will now be extended to childless adults as well. So that will be a benefit expansion for childless adults. You know, in terms of employer-based insurance, there's a lot of speculation about what it's going to cause employers to do. And actually, I would say even before the Affordable Care Act, more and more employers were really starting to direct their employees and get out of the insurance business. And interestingly, we're one of the only societies that has employer-based health insurance. And one of my other personal biases, as I often think, it's a goofy way to deliver health care. Because it's dependent on who your employer is. You change, when you change employment, your insurance changes and there are options. And I also feel badly for employers who have to deal with the cost of health care, and put that into their total compensation package when it has nothing to do with performance or the products or services that they generate. So it's always been peculiar to me. That is how our system is set up. And the Affordable Care Act attempts to incentivize employers to maintain insurance for their employees, but I think there will be more smaller employers who will opt out and find it more affordable for them to have their employees purchase insurance through the exchange.
I have a question kind of along those lines about employers. I have heard, and again, I
Yeah.
apologize, I'm asking you a question that you don't know, but
Yeah.
if your employer provides health insurance and it's technically affordable, but
Yes.
you don't really know what your options might be, and you go out to the exchange, that your employer will pay a fee just by mere fact
Yes.
that you go out to the exchange, which I think is unfortunate.
Yes, yeah. So I'm repeating the question, so if your employer offers affordable coverage that's 9.5% or below your income, and you choose to purchase insurance through the exchange, your employer has to pay a penalty of $2,000 to $3,000, just depending on the employer configuration. Because you purchased insurance out of the exchange. And part of it is, or purchased insurance through the exchange. And part of it is to create an incentive for employers to maintain affordable coverage.
But I had heard there was, it might not be the full 2,000, but I heard there was a cost, even if you don't purchase through the exchange, just by the mere fact that you checked your
You
options
look?
on
No,
the exchange.
no. Mm-mm.
Okay.
We can look all we want.
Okay, that makes sense, that makes sense.
Yeah, and I think it's a good thing to compare, to
Yes.
look at what options, yeah.
Can you explain this chart? I'm having a
Oh,
hard time
yeah.
following.
You know what, I don't have one right in front of me, I think I have a slide here of that. He's holding up that, thank you, the federal poverty level. So let's look at the first row where it says group 1. Group size is a family of 1. If your annual income would be $11,490 at 100% of the federal poverty level. Oh, and I'm sorry, the rest of those, probably the most important thing is just to look at the annual income. That's to give you a range of what 100% of the federal poverty level is.
Then what's the rest of the table? But when it says 100% below that, it says 957.50. What is that? What is the 957.50?
I think that is the monthly, it's the monthly income, right. It's the monthly income for that individual.
Oh, okay.
So at 100%, your monthly income is $957.50, right? Yeah. Other questions or comments? Yeah.
What if your employer does not offer insurance? Is there a penalty for that?
Yes. Employers, if they don't offer insurance, have to pay a penalty. I don't know the exact calculation. And then you can purchase insurance through the exchange.
No matter how many employees there are?
There's a rule for less than 50, and there's a rule for over 50. Mike, do you know that one?
No, I don't,
Yeah.
I'm sorry.
I deal more in individual insurance, but
Okay.
Brenda, I can follow up with you on that.
Okay.
Yeah.
And as far as, and this is kind of a random question, as far as getting people to dental care, like Badger Care, whatever, how, there's not a lot of resources.
Yeah.
Will there be more?
That will be the next presentation. So what I like to say is coverage does not equal access.
Okay.
And the first step in getting access is getting insurance coverage.
Mhm.
But even if you have insurance coverage, particularly Medicaid, there are very few providers who accept Medicaid because the reimbursement is so low.
Right.
So there are a handful of dental providers.
Right.
There are a handful of primary care providers. That's why the federally qualified health centers and the AIDS Resource Center and other community clinics are so valuable, because they have as their target population serving Medicaid beneficiaries. But that is a major issue. And there are many private physicians, private providers who don't accept Medicaid as well. So our next challenge and our ongoing challenge, which was the second goal of the Milwaukee Health Care Partnership, is to expand access to care and to find providers who are willing to and can financially sustain themselves by serving low-income individuals.
Thank you.
Yeah.
Is preventative dental care part of the Affordable Care Act
No,
also?
no.
Just Badger Care?
Just Badger Care, yeah. So how many of you know someone who might be interested in marketplace insurance? And I would just invite you, I have some cards here, or you can just connect with 211 if you need some assistance. Happy to connect you. I am not a certified application counselor, nor do I play one on TV. There's a wealth of individuals in our community who are eager to assist. Yeah.
Just with that last comment, I'm trying to do some research for my brother, and
Yeah.
I had at least 2 contacts with kind of local healthcare agencies. They weren't certified yet.
Yes.
And what have you heard about that with
Yeah.
just
Yeah.
with people being officially certified to talk with you?
Thank you. There are 2 healthcare organizations who, as of next week, health systems will be certified. The rest of them are certified as of Friday. So I can tell you which ones are, or any one of those public assisters can assist you as well, so that you can go there. Any other questions? Well, thank you very much for your attention to this work, and appreciate it.